Lawmakers hearing a proposal for the first time today to raise a Hennepin County sales tax to mostly fund HCMC. The hospital is facing a huge deficit, and while some lawmakers say this is not a perfect solution, they do agree the hospital is crucial to the state and say that helping it stay open is a bipartisan effort.
The fact that, this isn't a political issue, making sure that human beings in our state stay alive and have the basic things that they need is our shared work here. And so I just want to thank you.
The hospital is considered what's called a safety net and mostly serves people who can't pay or who use public programs like Medicaid. Jennifer Hoff is live at the Capitol to explain what happens next. Jennifer?
Lauren, to be clear, financial hardship is not an HCMC problem, right? This is something that is impacting hospitals all across our state and all across the country, even more so as the feds continue to reshape Medicaid, including changing eligibility restrictions and as premiums continue to go up. As for today's hearing, it was mostly centered around testimony. There was very little time for questioning and back and forth. Lawmakers saying they plan to hold another one very soon.
Good morning. It's 10:15-ish.
A tax committee hearing at the state capitol dedicated to one presentation, the chair calling unusual as a Republican and Democrat present a bill together for what Aisha Gomez says is the first time.
It's very complex, and we have a lot to work through.
Noting a shared commitment to try and find ways to keep Hennepin County Medical Center open. A renowned trauma and burn hospital in Minneapolis, serving mostly low-income and uninsured patients all across the state, especially susceptible, though, to upcoming Medicaid cuts that could mean losses of up to nearly $2 billion in the next decade. As the hospital's chair of emergency medicine says, it already laid off 100 people, cut just as many beds, and closed 5 programs.
And critically, we need a runway to design a more sustainable future, rather than making short-term cuts or funding Band-Aids that erode our long-term viability.
The only proposal to raise the Hennepin County sales tax created to build Target Field by 1%. Lawmakers agreeing it's not perfect as former patients petition for something.
We were surrounded by compassion, expertise, and exceptional care. They didn't just treat us, they cared for us as a family.
Hospital leaders say HCMC could close as soon as this summer if it doesn't get state help. And with just 6 weeks left in the session, time is ticking.
We have to continue as an organization to do everything we can to run more efficiently.
And that was Trevor Swallish. He is actually the CEO of North Memorial Health. The hospital, one of those hospitals rather, is in Robbinsdale. He stands to get about $24 million a year from that bill if it passes for that particular hospital. He says they are in the same financial hardship as a lot of the other hospitals. But he makes a note that all of those hospitals, including his in Robbinsdale, would not be able to handle any of the extra volume of patients. None of those hospitals, just to be clear, could handle the patients if HCMC closes. He has suggested forming partnerships with other hospitals and creating a brand new system. It's just one other idea out there, since, to be clear, there have been no other backup plans really presented other than raising this county sales tax. If they in fact don't get state funding and if that hospital closes. So it's good to have these conversations about what else can hospitals continue to do, again, if this bill doesn't pass, guys.
Well, certainly time is of the essence, and you bring up something important, that this is one of those rare occasions this session where there's a Democrat and a Republican sponsor, so people are working together to try and figure this out. Jennifer, thank you.